welcome to Podcast with Magnoni. This is a special edition, the first one of its kind where I'm talking to someone via Zoom, not necessarily in the studio, but I'm excited today because I have one of Malawi's very own doing great things outside Malawi, Musaiwale. Welcome, Musaiwale, to the show.
Thank you. Thank you so much.
Amazing. You know, every time I think about people that are staying in diaspora, I always imagine, what do you think about Malawi? Having stayed outside for some time, what do you think about Malawi? When you imagine Malawi right now, what comes to your mind?
Well, it depends on what you're asking. If you're asking about the current trends of things, then one would say something else. But always, Malawi is always home.
Yes. No, yeah. I think Malawi is home, and this is the best.
Always like thinking about what is happening.
Yeah. Yeah, Malawi is home.
Yes, indeed.
Worst, yeah. But yeah, home is the best, right? So yes, Musaiwale is into medical studies and innovation. I'm excited to have you. So I think let's go straight into it. So tell me more about what you do, and probably maybe a bit of your history coming from Malawi and then staying in the UK. What's the story like?
Well, if you want the long story, then we don't have time for it. But I mean, I work in clinical research. I do clinical research. I work for the Oxford University NHS Foundation Trust, carrying out some of the research studies, probably the most recent studies that you've noticed at the back of COVID, because I am specifically in infectious diseases portfolio and what is called the CRN. So it comes under the National Health Institute of Research. So basically, I lead that portfolio for the for what we call the direct delivery team, with an aim of like the name suggests itself, delivering research studies for our organization. So, in a nutshell, that's what I much do at the moment.
Interesting. And I noted that you are also doing a PhD study. Tell me more about that.
Well, that's another long story, but of course, I am doing a doctorate here in Oxford, as well as at Bath University, all those PhD or what they call here at Oxford University DPhil, what is called like integrated PhD, whereby you have one supervisor in your where you work, i.e. in my case Oxford, and thereby comes under Oxford University and at Bath. So it's again, my research focuses on the structures of the National Health Service, and more particularly as well in line with what I do in infectious disease portfolio. So looking at the structures that support its delivery, and so that's the theme of my PhD. And hopefully, fingers crossed, that will be wrapped up as soon. So yes, that's pretty much what I do in terms of my studies.
All right, interesting. When you were in Malawi, you were also working in the medical field, or you were doing something totally different?
No, in Malawi, I've never worked in Malawi, as per se. as per se. Of course, after finishing my studies, during our time, well, the usual Malawian thing that you finish your Malawi school certificate, and then probably if you're not taken to Chanko or Poly or whatever, you go to College of Accountancy. That's what I did, and then by chance, well, maybe you might call it by strategy, but I found myself in the UK, and after a while, thought of finding ways into which I can develop myself, and one way of doing that was to see what other things that I might do. So this is why I found myself into the health service. Just to cut a long story short. So yes. So after finishing my Bachelor of Sciences and Master's in Clinical Governance, another. Then I did management, and then another master here at Oxford. That propelled me to go on to do my PhD, which I'm doing. And like I said, hoping to wrap that soon. And fortunately enough, during the same period, someone also noticed me. Well, in terms of what I do in terms of my research contribution, and I was lucky enough to get into the Harvard Scholars Fellowship, of which, as we speak at the moment, this is what I'm doing. So I'm pretty much both a Harvard student, as it were, as well as doing my. So it's one of those things that going between Oxford and Boston, just doing my research study.
Interesting. That's a bunch of so many things, and yeah, you are blessed, so to say, to have an opportunity to learn at Oxford or in Malawi. The only way to know Oxford is by books, right? So you are reading this other Oxford book.
Right. Yeah.
So you're having a first
Yeah, of course. Yeah, I mean, one would say one is blessed, and I mean, I can say that coming from Dilandi, I was born in Blantyre and Dilandi. Of course, we can speak about my background, but for a fella that came out of Dilandi and went through, although we traveled. Malawi, because my dad used his job, we used to travel quite a lot. So Banja, Zomba, Zuzu, the long way. So we pretty much were like everywhere. So yeah, for someone who has been up and down, to find myself where I am today, I think one of the place with the opportunity.
Yeah. So anyway, let's get into this conversation around health care. I know you are doing a lot of things there. So tell me, what do you think about health care, the future of health care in Africa? We know that COVID really stripped of the glory that most health care spaces of Africa had all along. And I think we knew and we saw people dying because of lacking of basic things like oxygen and so forth. And then it really tells a story about how our health care system, most of the countries in Africa, that it's not in a good space, so to say. Your experience in your studies and all those things that you're doing, how do you look at the future of health care post-COVID?
Well, I think it's promising in one sense that there's a lot of collaboration between institutions, both from the West, the East, and of course Africa as well. The number of professionals who are working together to solve these issues in terms of healthcare. So on that front, I think there's been great strides to see that healthcare delivery is everywhere, and of course people who donate in terms of carrying out those delivery care have been at the forefront of making sure that that is done. So in terms of that, I think it's promising, and more importantly also is the idea or the awakening of using technology at the moment. So if we use, for example, at the back of COVID, as you have said, there have been a number of institutions as well as private organizations who have come up with ideas of how care can be delivered to poor countries such as ours, Malawi, and the young, and of course, in terms of the resources on the ground, you have a lot of doctors and nurses being trained, although some of them might seem in other areas that they do not automatically go to find work. But in terms of the groundwork, I think it looks promising. And with the opening of the internet as well, there's so much information going around. So, to answer your question in short, I think there's a great deal to be celebrated in terms of healthcare.
Yeah, that's really true. I think there's a lot that has been happening in terms of investment as well in the healthcare space post-COVID. Mm-hmm. Health is a serious conversation right now comparing to how it used to be. But I know that you also have an initiative, a business that you are developing in the healthcare space called Pampando. It's called Pampando Initiative or Pampando Healthcare. Tell us more about that.
So Pampando Healthcare is an idea that came about as well as at the back of COVID, or during COVID, where the emphasis was to look into what one can do in terms of contributing to the health space. So we do know that governments work hand in hand with private institutions as well as universities. And we at Pampando identified a space where we needed to have the resources needed. And so going back to the question that you asked earlier about what is it that we need, what is it, or how do you feel the health care would be in the future, it stems from this position whereby private institutions can work hand in hand with government institutions in delivering care. So if we take, for example, the vaccine program, for example, initially there was this thing of people not knowing what to do. So if you bring in organizations or companies such as ours, our aim is to be a bridge in that space whereby when things happen, you want something which is already available, and we aim to we aim to use our manpower or the resources that we do have to make sure that the process of delivering these items or this healthcare system is readily available, so that people are not unsure of what to do, and in the process saving lives. So what Pampando does, or what Pampando aims to do going forward, is one, to be partners with both big organizations as well as governments in making sure that we conduct research studies, we provide consultancy services in a rapid response manner, so that we save lives as well as saving money for both organizations and countries. So, I mean, just to use one example on what I've just said is, if you think about the agreement which the Malawi government, for example, has with Pfizer, has recently, in terms of giving or selling cancer drugs to Malawi on a cost basis as well. Pampando would come in. I mean, given a chance,
let's hope it
would come in. Sorry?
I was saying, let's hope that chance will come, that you can be part of
yes,
this
of course.
Pfizer deal.
Yes. But the idea, I'm just using an example because it's something that has happened recently. So Pampando would come in to because in this case, for what I mean is, we do not have, the Pfizer does not have the capacity to conduct all those things in Malawi, for example, just as well as Malawi would not have the same principles that Pfizer would require in the first instance, and at the same time you'd have an organization which can carry both the clinical research side of things, or help to navigate in areas in which the government machinery would not do in a rapid response manner. So this is one example that I was trying to drive out. But of course, we do know that the government can do these things. We do know that universities can do these things. But we need something which can also have a rapid response in terms of how you can deliver these things.
Interesting. I think adding value to the healthy care delivery is one of the key elements for national development. For specifically, I'll speak for Malawi, because I know that if it comes to healthy care delivery, there are so many challenges, and there's a lot that is needed in terms of innovation to change the story of how healthcare care is delivered in different communities. I want to get your thoughts around last mile health. What do you think are the technologies or maybe ways we can improve last mile health? If you come to Malawi, you will find that the health care in the last mile spaces is quite bad, right? And there's a whole story around people being very few in those spaces. There's so many conversations around even infrastructure and even availability and stuff. What do you think can be done to improve health care delivery in the last mile spaces?
So I think for this question, this is where people like yourself come into play. People who are so like their gigs in technology. That's one area that one might look into to help in the last mile. And of course, going back to Pampando, that's another area of how we want to take that space. Because if you noted the last mile as well, majority of them are done by foreign organizations. And these foreign organizations, they do not have the capacity on the ground, which means that sometimes the delivery of it of care is haphazard in some cases. But of course, it's sometimes and probably I might not speak for Malawi, but they use government officials as well to go into. So they will go to a district hospital or a community hospital to ask for help for people to. But then, what is it that goes in, and how does that benefit the community as well in these areas? So to answer your question, I think the use of technology. So, for example, mobile phones, in terms of someone in a village would need to connect to a clinician or a nurse. Having the spaces or someone developing something that will enable to process these any issues that one might have. So, for example, if I was a patient in Sanje or Chitika, and I am desperately looking for a doctor, we need to have a space whereby people, because even in the village, people will have 2 mobile phones. Now people are on WhatsApp every day, and the same principle can be applied for last mile, where you do not need a person physically to be there. Sometimes what someone needs is a reassurance of something, or that what they need is to tell them what to do, the ABCs of healthcare. Right? So I think it's one area that I think the concentration needs to go as well. On top of the manpower, of course, having someone there, I mean, it's reassuring, but also using other spaces where we can the healthcare delivery can reach to an individual in the remote areas.
Yeah. I think very important. You have recited the very important aspect, because I feel like in the last mile areas, the challenge sometimes is all about advisory, right? Which can be accessed if we make sure that technology is available, but also known to the people. They know that the technology exists and they are being taught how to use it. I think it would be interesting to see what you do to people who sometimes would stay with diseases for a long time and die from diseases that they were supposed to be cured from because they were simple diseases.
Yeah, exactly. And I think that's the most important. Most important point that you make, because sometimes we only look for emergency stuff that come about, but we do also have like long-standing commodity, long-standing issues. So, for example, one could have diabetes, asthma, and all those kind of ailments. So you need. So, for example, you have diabetes, for example. All you need is to inform someone or to tell someone that maybe my medication is run out, or I'm having issues. How can you help? And instantly you have that response through your mobile phone. I think that's one area that can be utilized in that sense.
Amazing. That's really true. Maybe around the same issue, what do you think about data, the quality of data that people collect on health care? Because I think we learn from data, right? We learn from research, and you are doing research from that end. What do you think countries like Malawi, African countries that have a lot of these last mile spaces where people can hardly access quality healthcare, can leverage data to improve on their practices?
So you mean in terms of safeguarding data, or using
data in terms
of delivering care?
Data in terms of understanding what is happening, so investments can go in the right place and so forth, so that people understand.
Yes. I mean, that's another important point. So I know for a fact that there is a department in Malawi that collects data and then which aims to advise on policy on what the next steps would be. I had an opportunity last year to work with those guys, and in terms of the data that is available, of course, it's something that one also must stand. Which kind of data we're talking about. This is why I did ask about what is regarding or the use of data which is readily available in the system that you can use it to form policy. So yes, I mean, if data is used in the right manner, it can be beneficial both to the government and of course to individuals, because what it does is to inform the current evidence-based healthcare, as if you want to call it, that what you are doing at a particular time is what you're doing at a particular time is what you really want, so that your people can benefit from it. Because sometimes, normally, what happens is that you would find that you have the data, but for some reason, because of restrictions, you are not able to use that data to inform policy, thereby restricting care, which comes after clinical research, or which comes after research studies. So that's one area, of course, that maybe needs to be opening up. But of course, I do know that that's like, for example, in Malawi, it's opened up, and I know a lot of colleagues that I've worked with over the years who are doing particularly that.
Interesting. So, if, for instance, let's assume that you were coming back to Malawi tomorrow to advise on Malawi's healthcare to improve the status quo from an outside perspective. What would you think would be the areas that you would focus on as an advisor for the Ministry of Health?
That is a big question.
On top of your head, I know you need to look at the data, look at the policies and stuff. But on top of your head, what are the areas you would recommend that Malawi would step up on?
Well, like I said, see, this is one thing. Malawi has got brilliant, brilliant minds. As we're speaking at the moment, on a daily basis, I speak literally on a daily basis. I speak to a lot of people who have the expertise in what needs to be done, and these colleagues would, in most cases, have more ideas on what needs to be done. So I think, coming from the outside, you can only work with people and probably chip in one or two things that you might contribute to something. But in terms of the structural things on the ground, I think Malawi has, and is known to have one of the brilliant minds in terms of coming up with ideas on what to do. I think the only thing that fails us is the implementation, and in most cases, and that goes across the board. So I don't think you need someone like me to advise. I mean, you do. Malawi does have people who are able to deliver.
And I know you're playing it humble. You're trying to be humble, but I know you would have a lot of thoughts to what would be the improvement plan, probably in terms of healthcare. I know there are a couple of doctors around here, and you have pointed something which is very important, and I think we can. As we are going to a close, we can talk about that. Where you say Malawi has brilliant minds. It's true, as brilliant as mind. But the question is always, why don't we initiate solutions for our own, and we only wait to do something when there's a funded program, and then we want to be a team leader and lead that? Why is it difficult for Malawians to develop solutions, technology for fellow Malawians, and change the whole story around the last mile health? Why is it difficult for Malawi to transform, maybe, but we have brilliant minds that are there? Why do you think that is the case?
Oh, there are two things. The elephant in the room. If you go back by what is happening at the moment, so the elephant in the room is politics. So that does not allow people to come in and have this thing of wanting to do more for their country, both within and outside Malawi. Another thing, like I said, is the implementation. So if you think about, there are two things, and this always comes to me. Do you know, when you are in primary school, I don't know what the primary school you went to, but for me, I went to maybe it's not a good.
You will forget. I went to St. Teresa Elohim. You will even forget the primary you went to. It's quite a long time ago.
Yeah. But my point is, if you notice the people that were number 1 to up to 5 through primary school, secondary school, maybe university is different, but you would find that the majority of them, what they're good at is good at in school, in class and library. So it was library, class, bed, or maybe going home. But what I'm driving at is that we do not have the emphasis on networking. So you and I can speak and share ideas. So if we are not able to share ideas, you could be top guy in your class. I could be the top guy in my class. But if you're not speaking in terms of what is going on around us, then as we grow up, we do not build that space. So if you come like this side of the world, you will find that people are encouraged to network a lot. So school in class is not considered as, of course it is important, but it's not considered as the only thing that drives. So you find that the majority of people who do network, their productivity also skyrocket, and this and that's another problem in Malawi. That if we are talking about issues in and all that, and get lost to that fight and not coming up with ideas of how can we work together. And now if you come out of that, you'll find that we are not networking in terms of developing our country. We are all in our groups discussing other issues that are not relevant to uplift our country. That I think the next generation or the new generation coming up, you've got different ideas on how people are looking at issues. So it's not so it's not bad. But because now everything's open up, you can open Twitter, you can open whether you're on. They would not normally discuss previously. So that's another advantage of new technology.
Yeah. Interesting.
Hopefully, we can captivate from that. We can captivate from that and then use it to development of our country.
Interesting. I think partnership is one of the major issues, as you mentioned, that we need to work on. People with brilliant ideas want to work alone, and then they end up building nothing because in unity there's power, but we find nothing happening because we don't work together. And yes, politics is a huge thing in Malawi. Politics is a huge thing. I don't want to talk about politics a lot, but yeah, cool. I think we've spoken for some time. I don't know your last thoughts. What do you think should be the focus in terms of for us to improve healthy care? And what do you what is your vision around healthy care and what you want to build with Pampando in the long term?
Okay. So in terms of Malawi healthcare, I don't know. I can't remember what was allocated to the budget of healthcare, but I think we need to be serious about what we are allocating to the national healthcare in Malawi, because we cannot have a situation whereby the majority of people are languishing in their villages, and yet a few people would be able to travel outside and get the care they need. A great example also in terms of wanting to do more for our own healthcare is what happened during the COVID. If we are serious enough and to take examples from them, or to learn something from them, I think one would allocate a lot more to healthcare and thinking strategically what the future holds in terms of healthcare cloud. As regards to Pampando, I think in Pampando we want to work with the registered in UK. We are also in Malawi. Those are our business, but we want to work with other partners, and we have studied that in other countries as well. So that's the plan for Pampando, and we hope that goes well.
Amazing. Wishing you all the best, honestly, and looking forward to how Pampando will come in to support Malawi, but also how the brand is going to grow. I think we have so many businesses in Malawi, but innovations around healthy care are quite few. I think we only rely on funded programs and not initiatives that are being developed from within by our own fellow citizens. So that's amazing. That's great. It was great having you in this chat. And looking forward to catching up another time, honestly, to discuss about healthy care and what Pampando is going to be doing and so forth. But wishing you all the best, and hopefully when you're finalizing your paper, your PhD paper, so many things will start coming up because of your research and so forth that you are exploring that from the end.